To shine a light on some of the great work being done by our team and the people we are working with across the healthcare system, we've decided to host an inclusive digital transformation week as a way of sharing some of our stories, learning, assets, and to hopefully propel the change that still needs to happen to make digital healthcare equitable. I am joined today by Kirstin Blackwell, who is our Deputy Director of Inclusive Co-Design. Kirstin, would you like to introduce yourself properly and tell us a little bit about your journey to Thrive by Design?
Thanks, Rob. So thanks for having me. It's lovely to be having this chat with you today. So I joined Thrive by Design at the back end of 2019 after spending the best part of 10 years with an organisation that focused on the provision of health information, importantly looking at barriers such as health literacy and what providers of medicines, interventions or other support could do to ensure that everyone could get access to the information they needed and understand it as well. So to give an example, I led some projects looking at clinical trial pathways and the information people kind of have put in front of them when they're considering taking part in a trial, and what could be improved there, as well as how the results are then disseminated to the public after. So there's a lot of voices to kind of listen to and balance in that space, from people and families who are considering taking part, sometimes at a really difficult time in their lives, through to clinical staff, and also lawyers and regulatory folks as well. And I guess that's where my interest and passion for co-design started, kind of really seeing the kind of the power of sharing kind of stories and experiences amongst a group with kind of quite diverse needs, and kind of the impact that then had on the process. So when an opportunity came up to join Thrive by Design, or Habitat as it was then, I was really thrilled. So being based in Leeds myself, I've been aware of the team and the fantastic work that's been happening here for a very long time. And I've now been here 2 years myself in a couple of roles, and really seen the organisation reshape and evolve in that time. And it's been a real pleasure to be a part of that.
Oh, brilliant. Thanks for sharing that, Kirstin. And interesting to hear how you kind of gravitated towards what was Habitat then from the work that you was doing. Now, our team specialises in mental health and is hosted by a mental health foundation trust. Are you able to give us a broad overview of the different work we are doing across this space?
Yeah, definitely. So I'll firstly say that we're really proud to be hosted by Leeds and York Partnership Foundation Trust. So that's the mental health trust you mentioned here in Leeds. So within the mental health space, I'd say there's probably a few different strands to our work, really. So we do some work that's focused on the inclusive co-design of specific tools or services. So, for example, we run Mindwell here in Leeds in partnership with Volition, which is a mental health information and support website. We recently worked with a group of young people and clinical staff to look at how digital might support young people who are approaching a crisis point, and kind of what tools might be available to them to use at that point. And we've also done some work in West Yorkshire, looking at kind of, or working with people from primary care and secondary care mental health staff, to look at how a digital decision-making tool might support better interactions, and also ultimately result in more appropriate and higher quality referrals from primary care into mental health services, and better support the people that we're all here to sort of support. And then I'd say the sort of second strand is around our inclusive digital transformation work, which is focused on how we can kind of work across the system to co-design inclusion into the digital transformation process as early as possible. So we've been exploring the landscape for inclusive digital transformation within mental health across the country, as well as then focusing in on some of the component parts of that. So, for example, we worked with NHS Confed to develop a digital skills guide to help staff build their digital confidence and skills. And we are working with our own trust this year to co-design digital inclusion interventions across 3 different services as well.
Great, that's fantastic. Yeah, so much work going on in that space, and I know that, like yourself, feel privileged to be able to work across those projects, knowing that we're making a contribution in that area. One of the other big projects that we've done around mental health is, over the last 12 months, we've been delivering a national programme which was commissioned by NHS England and Improvement, and that was really to carve out the path for inclusive digital transformation across mental health and care services. I know that you've been leading on that work, so are you able to share an outline of the project and its different phases?
Yeah, sure. So this is a piece of work that's been kind of a core focus of mine and the team since around, I think it was May last year when we kicked it off. So the goal of the project was to explore ways in which to enable a more inclusive digital transformation approach at a local, regional and a national level. So the scope was quite wide, really. And we've done that through initially completing some discovery work, which we did last summer, to explore what's kind of currently happening across the country in this space and kind of draw out some case studies and examples, etc. And then in the autumn last year, we ran 2 work streams in parallel. The first was delivering a learning programme specifically for those working in digital transformation roles in mental health on inclusive digital transformation. So we had a group of 30 wonderful people from across the country who joined that. And we also ran a co-design process, bringing in the discovery findings and also the living and learned experience of the people in the group to co-design a guide that will support inclusive digital transformation in mental health. So the final part of the work, which we're kind of on with now and wrapping up now, has been to produce the guide that has come out of that piece. And we'll also have some kind of assets to publish, including a report and a briefing containing those discovery findings as well.
Brilliant. You mentioned it there, but the national programme touched on place-based and system working. What opportunities do you think ICSs provide for inclusive transformation within mental health services?
Yeah, okay. So I guess our findings point to integrated care systems, or ICS, as being absolutely key, really, for all of this going forward. So we know that kind of local level relationships and partnership working are really important here, and ICS is obviously well placed to ensure that can happen. I guess through our work, we wanted to point to, I guess, the need to recognise the value of the voluntary sector and other sort of community organisations and trusted touch points in people's lives when it comes to kind of reaching groups whose voices may be seldom heard. These communities are more likely to have a higher prevalence of mental health illness and health inequalities in general. So for digital transformation and mental health to be more inclusive, we need to be engaging these groups and working with them. And we found, I guess, through our review of what's happening across the country at the moment, so there are some ICSs that are already kind of pioneers or early adopters in this space and are really taking a systemic approach to inclusive digital transformation, embedding this across their area, making it really clear from a leadership perspective that this is a priority, etc. But in terms of, I guess, linking that in with mental health, there's probably some more work that could be done to ensure that kind of, the specific needs of service areas like mental health and probably others as well are really being served by these approaches. And I think something that will be really key going forwards, and this again will be a real opportunity for ICSs as well, will be creating the conditions for those working in mental health across sectors to be able to really share their learnings and successes and challenges as well, and kind of learn from each other in a place, but also across the country.
Yeah, there's definitely some similar themes coming out from kind of this conversation and conversations I've had earlier in the week. And I'm looking forward to speaking to Tim on Friday about the Digital Pioneers project, which has been working with 10 ICSs. So I think he'll probably have some similar reflections to share as what you've just done. So looking back at the programme, what would you say are its biggest achievements and what work is on the horizon for this project? Yeah,
sure. So it's really interesting to reflect on this at this point in the work. So thank you for asking that question, Rob. I'd probably say that the level of engagement we've had with this work has been something I would particularly want to celebrate. So there's so many people across the country have taken the time to input to this across the last year. So be that whether they've completed a survey, kind of had a chat with us in an interview, joined one of our groups that have been running through the project. So we've had a co-design group and a reference group that have been engaged the whole way through. Then we had all the people in the learning programme, etc. And I guess all the way through, people have been really kind of open and honest and shared their insights, which has really allowed us to kind of understand that landscape that's out there and what could be the opportunities going forward. And we've had input from sort of people working in quite diverse roles as well and across different sectors, and people with living experience of using services. So yeah, it was a good opportunity to be able to sort of thank all of those individuals really, and we're grateful, as we always are, for people sort of giving their time and energy to this. And then you asked me what's on the horizon. So yeah, so what's next? So we are currently working towards launching the first version of the guide. So it will be a kind of a prototype that will evolve over time. So the guide has been co-designed with the mission to support and motivate organisations and systems to both adopt and scale inclusive digital transformation in mental health. So the guide will, as you'd expect, provide kind of information and content and resources. But equally as important is the community that we'll be aiming to build around the guide as well. So that was something that was really kind of prioritised in discussions that we had.
Brilliant. Yeah, I've been involved in that piece of work, and yeah, really excited to get to share that with people. You've mentioned the guide there, and it's aimed to build community around mental health and inclusive digital transformation. What are the benefits of that community approach, and how can people get involved with it?
Yeah, so I think I said before, so this has been something that has been really prioritised and something that's really key for everyone that's been involved in co-designing the vision for the guide. So I think it kind of, we need to acknowledge that this is a fairly new space for us all, and we don't yet have all the answers or the evidence that maybe is needed to really push this forward. So the community approach will allow for kind of us building connections across organisations, across places, across the country, with people that are kind of facing probably very similar challenges to adoption of this stuff. And if we can create a space where we can share those challenges in a really open way, share ideas, possible solutions, and celebrate those successes as well that people have, we hope that we'll be able to inspire people, I guess, to move forward in their own journey. So that's going to be a really important piece for kind of allowing that to happen. We're going to be hosting the guide itself on Future NHS. So that's a platform which already has some functionality to allow for that community interaction to happen within the same space where the sort of content and the resources will be hosted. And we'll also be looking to host some events that will kind of spotlight work that's happening in the area. And really we want that to grow and kind of other ideas to come from the community as well. So it will grow over time. We're really keen to kind of test different things out and see what's most helpful for people and kind of what works and doesn't work, etc. So in terms of getting involved, I'd say at the moment, keep an eye out for launch events that will be coming soon in the next month or so. We'll be sharing those on our Twitter and probably other spaces, and we'll keep everyone who's been involved in the project informed about that. So come along to those, share with colleagues, and kind of access the guide and start interacting with the community, and then keep us kind of informed with what your ideas might be for how we can kind of improve this and really build that community going forwards as well.
Brilliant. Yeah, and what we can actually do is when this goes out, we can post links to the workspace, the main workspace alongside it. So if anybody's watching this and would like to join the Inclusive Digital Transformation Challenge workspace that's already live, we can share a link to that. And obviously from there, when the guide launches, they'll also be able to access that as well. So we've got the guide that you've just mentioned, the discovery report's going to be coming out soon, as well as our policy and practice briefing. So to complement them, what would you say is your top takeaway tip for being involved in this work that people should consider to get started?
Yeah, so it's interesting you said get started there, because I was thinking about this before, and I think I'm going to go for quite a general one actually, but I think it is really important. So I think it's about us all kind of acknowledging that it's okay to kind of just be starting out on this journey and kind of working towards making digital transformation in your service or organisation more inclusive. So it's really important that we kind of, on an individual or team or organisation level, really acknowledge where we currently are, and start from there. So kind of it's about a journey, and we've kind of talked about this in the guide. It's kind of about getting started from where you currently are and taking steps in the right direction, and understanding that there are other people out there that are kind of doing the same, or they might be a few steps ahead, and they might have some sort of tips they can sort of share with you, and this is about us all kind of moving forwards together and learning from each other, and I guess we really hope that the guide and the community we're building will support that, and yeah, it'll be really interesting to see kind of, you know, a few months down the line, a year down the line, kind of where people have got to and what people have managed to achieve and share with each other in that community as well.
Yeah, and that guide's going to be crucial in doing that. I'm really excited for it to launch and for it to be out there and to kind of see it grow and to pull those stories into it. It's been really interesting to chat today, Kirstin, and anyone watching should definitely keep an eye out on the social medias and on a future NHS platform for links to all those resources, reports and different bits that we've mentioned throughout this chat. As always, do get in touch with us directly if you've got any questions about the work that we've been doing. And last thing to say is, Kirstin, thanks for taking the time to speak to me.
Thanks, Rob.